Hey, good evening. This is Dr. Yamuna from Apollo Hospitals, working as an infection control professional. Namaste. It gives me an immense pleasure and pride to present about our project on outpatient antimicrobial therapy. Healthcare has become one of India's largest sectors both in terms of revenue and employment. Indian healthcare delivery system is categorized majorly into two components, public and private sector has emerged as a vibrant force in India's healthcare industry. It accounts for about 74% of country's total healthcare expenditure. Most developed countries have a widespread insurance network in the health sector, but in India, the percentage of Indian population having a health insurance is still very low. So the healthcare access in India is affected with 70:70 paradox, in which 70% of the healthcare expenses are incurred by patients from their pockets, of which 70% is spent only on medicines. A study which was published in 2018 by Sushmita Chatterjee has helped us to define the problem statement, since the margin of admission of patient in a private sector is very high. So this helped us to guide our path for the new venture of OPAT services. Outpatient parenteral antimicrobial therapy is a method for delivering intravenous antimicrobial agents at an outpatient services to patients who present with moderate to severe infections but otherwise who are clinically stable enough to be discharged from the hospital. This service has been practiced in many countries, right from US to UK, but the very concept is very new to our country. So to define this problem statement, we did a retrospective study of about 100 patients who presented with acute pyelonephritis with ESBL producing bacteria. Usually these patients need to be treated with antibiotics for 10 to 14 days in hospital. But when we did a study of these patients getting discharged who were treated for a long course of antibiotics as an outpatient setting, the margin or the cost incurred for the patient was very low and it had a significant p-value. This problem statement defined by us helped us to define the components of OPAT. The OPAT team was created, roles and responsibilities for each stakeholder was defined, a service structure layout was done, OPAT process, patient selection criteria, all were put into proper place to begin our OPAT process. So the ultimate result which came across to us after starting this OPAT process, a very good feedback from patient and family who said they were very much satisfied with the treatment, less expensive per episode than hospital-based treatment by 30 to 70%. So it is definitely a cost-effective model. And outcomes in terms of complications showed no difference between an OPAT services and inpatient services in terms of infection. OPAT frees actually the inpatient capacity so that the bed strength can be utilized more and further for admitting other patients. It is associated with a very low rate of healthcare associated infection. Since our OPAT program is operated with infectious disease consultant in both the initial design of antibiotic protocol and ongoing patient care, it functions well within the context of antimicrobial stewardship program. Proper utilization of hospital resources and direct supervision and expert opinion is available. The only challenge which we faced were the maintenance of IV access and also the training to the ground level staff to prevent bloodstream infection. Otherwise, this intervention which we had carried out was definitely a cost-effective process. Our intervention is definitely a new approach as this kind of project is alien to our country and it will definitely help in decreasing out-of-pocket healthcare expenditure in India due to public demand. It provides quality service at an affordable care. So this would help us in improving our health tourism, where patients from different parts of our country would be benefited. This would also make our hospital a popular destination for people across our country seeking healthcare. Thank you.